So welcome. I'm going to wait a little bit as you all start joining this webinar, but welcome to this inaugural virtual webinar, Careers information session this lunchtime. We welcome not only delegates from Canada, but also from international. So thank you for joining us. As you all start coming in, I have put a screen up there because actually this year is our 50th birthday. Our celebrations will be postponed until next year, but we turned 50 this year, we were born the 8th of June 1970. As you'll see, in the old days we were called the Canadian Academy of Sport Medicine. We changed our name in 2010 to the Canadian Academy of Sport and Exercise Medicine to more accurately reflect the practice profile of the sport medicine physician. We hope that this webinar will give you a good broad view on the different routes that you as medical students and students can take to become a sport and exercise medicine physician in Canada. We have 3 presentations this lunchtime. The presenters themselves will introduce their area of medical specialty within sport medicine, and they will each describe their own route to become a sport and exercise medicine physician and some of the opportunities that they have had as part of their work in sport and exercise medicine. A little bit about CASM. We are a academy. We're based in Ottawa. Our members are all physicians from across Canada and from across specialties. We came out of the 1968 Summer Olympics in Mexico. And the story goes that the team that traveled at the time to Mexico came down with diarrhea and sickness. And it was felt there that we needed some good expertise to be able to keep our athletes safe and well. And from those games, the Canadian Academy of Sport and Exercise Medicine was born. Our membership breakdown, this is just very quickly to give you a sense of who our members are. Come predominantly around 60% from family practice, and the rest of our membership are from a variety of medical specialties. Today you're going to hear from a pediatrician, but it could very well be an emerge doc, an orthopedic surgeon, PM&R, a couple of anesthesiologists, and a new psychiatrist. So we do have a mixture of specialties in family practice and primary care sport medicine physicians within CASM. So on that very brief introduction, I'm going to introduce Dr. Erika Persson. She is a pediatrician. I will let her introduce herself and she'll tell her story. Thank you.
Well, thank you everybody for attending today. Hope everybody is able to see the slides. We tested it out this morning. So my name is Dr. Erika Persson. I'm a pediatrician based in Edmonton, but I do pediatric sport medicine as my sole practice. So I'll take the next probably 15 minutes to give you a little flavor about my journey to becoming a pediatric sport medicine physician. So first off, I just like to do some disclosures. I have no relationships with commercial interests, but I do have some relationships with some national teams and caring for certain athletes at certain schools here in the city, as well as a local gymnastics club. So I am a national team doctor with Skate Canada, which is our figure skating program here in the country, a school where I'm sitting at right now, so which is Vimy Ridge Academy, which is a sports school here in Edmonton, as well as Capital City Gymnastics Club in Edmonton as well. So, oh, and why is this not going? Oopsie, sorry guys. Oh, there it goes. So people are probably thinking, pediatric sport medicine, is that even a thing? And I can tell you, when I started medical school, I had never heard of it. I had never heard of sport medicine, actually. And it was only through the course of my medical school and then residency and then happening into meeting different individuals from across the country that I realized that this is a specialty and it was something that I wanted to pursue further. So it is a sort of toddler specialty within sport medicine itself. In pediatrics, there are a number of subspecialties that have developed over the years, including pediatric orthopedic surgery, pediatric emergency doctors, pediatric PM&R, pediatric rheumatology, and now we can add pediatric sport medicine to this. And all of these different specialties, in addition to primary care and family physicians, treat active children and youth. And these kids show up in various clinics with acute injuries, with overuse injuries, with sort of chronic concerns. And any one of these individuals often do treat and assess these kids. We do now have some pediatric specific training programs in sport and exercise medicine. And as a result, we are seeing increasing numbers of pediatric sport medicine physicians as a sort of subspecialty. And I can say that my training program was one of the first in Canada. And talking with my mentor and my preceptor through that year, I was kind of her first resident or fellow for a full year intensive program. So we were kind of trailblazing a little bit in terms of what we had to do to put it together and what experiences I would need to become a successful pediatric sport medicine specialist. So how did my winding road kind of come to be? I did medical school at the University of Alberta here in Edmonton, and during my pre-clerkship years, I loved anatomy. I just kind of found it super interesting, and I loved going into the anatomy lab and doing dissection and whatnot. And I even, during my pre-clerkship years, went into the anatomy lab on my own, and our group was able to dissect the upper and lower limb together, but I loved it so much that I took some extra time and went back on my own to dissect the opposite side, upper and lower limb on my own. I just loved it. And then during clerkship, I really liked my pediatric rotations and found that this was kind of my happy place, going into work every day, going into rotations. And I loved the families, I loved the kids, I loved interacting with the family unit. And it just seemed like everybody was happy there. And I was happy there as well, and felt like this was kind of where I belonged. And then as a result of some electives I did, I thought my career path was actually going to be pediatric oncology. I had a wonderful fourth-year elective with some great preceptors and thought, yeah, this is where my life is going to take me, and that was my plan. So I applied to pediatrics residency across the country here in Canada, and was successful at obtaining a residency at the University of Alberta in Edmonton at the Stollery Children's Hospital. During my 4 years of residency, as I did complete the full 4 years, I was just drawn to teenage patients. And so my thoughts started to change a little bit, and thought, okay, am I going to do some work with teenagers and maybe adolescent medicine? I just found them very challenging, but also very satisfying group to work with. And then it happened to be a chance discussion with one of my co-residents who came from Winnipeg, and she told me about this physician who was working in Winnipeg as a pediatrician and a pediatric sport medicine doctor, and she worked with the students at the Royal Winnipeg Ballet School. This piqued my interest because my background in sport was actually dance. I danced professionally for a little bit, as well as taught dance to kids and young adults, and danced growing up. So I thought, this is kind of interesting. Is this a way to combine my loves of my vocational passion, which is dance, as well as my sort of education passion, which is medicine? So I reached out to this physician, and she was gracious enough to let me come and spend a month with her during my residency. And when I was there at the University of Manitoba in Winnipeg with her for the month, I kind of went, yep, this is what I want to do. I'm even just getting chills talking about it right now, because it pretty much changed what I was going to do with my life. And it was very much a combination of all the things that I liked doing. The kids were healthy, the kids were energetic, the kids loved being active, loved being into their sport, and I was able to help them continue to do the things they loved. So after that elective, I talked to my preceptor there, and we pretty much set up my fellowship program because it hadn't been done before in Canada. So we kind of figured out how we were going to do it, how I was going to obtain some funding. And at that time, the financial situation in Alberta with the government and the universities were pretty good. So I was gracious enough to be granted a 5th year in residency and was able to complete that in Manitoba, but was being paid by Alberta, with the caveat on that plan that I was going to be returning back to Alberta to share the knowledge that I learned in Manitoba. So that brought me to my 1-year fellowship in pediatric sport medicine specifically. I did have some adult experiences, as that is an important part of a fellowship program. And Dr. Bradley will be probably talking more about that in her talk here in just a little bit. But my fellowship was clinical based. I had clinics at both the Children's Hospital as well as a private sport medicine clinic. And then I did on-field experiences. I did work at the Royal Winnipeg Ballet School weekly while I was there. Also worked at a gymnastics gym when I was there too, and had the opportunity to be involved with various events that were happening during that year, including the Manitoba Marathon and some speed skating events in their outdoor oval. So I got a very broad exposure to what life as a sport medicine doc, and specifically a pediatric sport medicine doc, would be like. And then at the end of this year, or end of that year, I did write the CASM diploma exam. The diploma exam, as you will be hearing about, is a general examination. It's not pediatric specific, it's not adult specific. And with the training that I received and extra work I put in for areas that I maybe did not get as much exposure to, I was able to be successfully completing that examination. So you may be thinking, okay, well, you're a pediatrician. How do I get to sport medicine if I'm thinking of a non-primary care route, non-family practice route? So that here in Canada would be the Royal College of Physicians and Surgeons. And you do need to complete your primary residency first. So that could be in emergency medicine, pediatrics, physiatry or PM&R, orthopedics, internal medicine. So you're going to do your primary residency that way. So that would be going through the CARMS match after medical school. And then once your residency program is complete, then it would be applying to fellowship programs. And there are a number of, I'm going to speak for pediatric specific, most of the pediatric specific programs are in the States. As I said, there's the one here in Canada, in Winnipeg. But most of the fellowship programs in Canada are adult-based with some pediatric exposure. And in the States, the one thing, if you're thinking of going that way, is to think about residency issues, as I did look into going down to the States to do my pediatric fellowship. However, some of the programs did not accept out-of-country fellows. And also to the payment you had been receiving to do your fellowship program and the funding that you would get also had various levels. Some were quite poorly funded, some were well funded. So again, that was part of some decision making that you'll have to think about if this is the route you think you're going to go. And I know Dr. Bradley will talk a little bit more about the Canadian fellowship program specifically. Once you've done your fellowship, then it's the Royal College has actually had this new sort of area of focused competence, or the diploma as it's otherwise known. And sport medicine in general has been approved, and they're right now currently in the process of accrediting individual training programs. So that's for fellows that are in the fellowship program currently, and it's a portfolio-based sort of evaluation system. Right now, the practice-based route to the AFC or the diploma is still kind of in process and in the works. So always updates would be on the Royal College website under their AFC section to update that. But right now it has been approved. So you could get another, I think they're going to call it the FRCPC instead of just your regular acronym after your name after you complete your Royal College fellowship. And then the practice route is still kind of in the works. So stay tuned. So, done fellowship, now what? What does real life look like? And I think this was part of my biggest challenge, is coming back to a province who didn't have a pediatric sport medicine doctor. And I had to start out by educating colleagues in healthcare organizations about what actually is this? What is pediatric sport medicine? And what is sport medicine in general? And what do I do? I can tell a bit of a story about when I started and came back. I talked to the chair of the pediatrics department, and they were talking about, oh, well, we have a position in the NICU. And I kind of had to chuckle to myself, because I'm like, okay, NICU and pediatric sport medicine, I think those are very two separate things. So had to start right from the beginning about educating about who I see, what I see, and how I can be of value to our active youth and kids in the province. Persistence paid off, and I did start to educate and get the word out about what I did. And then I was lucky enough to fall in with a group of physicians that did practice sport medicine, primarily adult-based, and was able to join that group as their pediatric specialist. And I would say, kind of in real life, there was some questions before the presentations today about how about going about setting up a practice. And my advice would be trying to find a group of like-minded healthcare professionals that create your network. And this could include non-physicians as well. And I know across the country how practices are set up or can be varied. Here in Alberta, most physicians practice with physicians. But I know in other provinces, there, especially in sport medicine, physicians can be practicing with non-physicians such as chiropractors, physiotherapists, athletic therapists in the same sort of clinical space. But it's kind of creating that network of the like-minded professionals that have the same view on things as you do. The other thing that was very successful for me was getting out there and connecting with the youth sports organizations, teams, and clubs with your goal of providing enhanced care for their athletes and trying to improve their performance and improve their safety. This is kind of akin to getting your foot in the door, and that took a little bit of work. But if you can develop those trusting relationships based on the common goal of everybody wanting to be there to make the athlete the best they can, I think you'll be really successful. So it's kind of pounding the pavement and getting your name out there and connecting with those individuals that do see and train the youth athletes. So I thought I'd just take a little bit in the last few minutes I have here to talk a little bit about the week in the life of me. So my Monday afternoons, I work out of a community clinic, actually just changed this summer. I'm actually now out of a pediatric physiotherapy clinic in the city here in Edmonton. So I work both at a physiotherapy clinic in the south part of Edmonton, as well as a community clinic, physio clinic in St. Albert, which is a bedroom community to Edmonton. Tuesdays, I'm kind of at my home base physio clinic doing new patient consults and follow-up visits. Wednesdays is kind of my academic day, so I get to do some of my academic work, but I also go to the local gymnastics gym twice a month to provide on-site care there, so they don't have to leave their training. Thursdays is today. I'm on site at a sports school providing care to the student athletes here, and right now we've got a combined junior senior high, and there's about 1,000 students attending the school here. So I do a drop-in clinic for the students so they don't have to miss school nor their training sessions in order to come see the doctor. And then Fridays, I'm back at my home-based clinic. I just like to point out that some people may wonder, okay, how do you get paid? All of my services are fee for service. So I'm not on a salary and I'm not on a government, what's called alternative relationship plan. So I don't get a salary from the government. I get paid based on the number of patients I see. So that is something that may be important to you as you kind of continue your journey through training, about how you feel comfortable and how you'd like to be paid, and in terms of the various strings that are attached to each one of those types of route to payment. I also do field and event coverage, and this varies depending on the year and the season and what events are being held. Most of these jobs are volunteer, and I know Dr. Menard will be talking a little bit more about that, but I often receive honoraria, or the travel is paid for. And this is both local, national, and international events that I have done and I do. My academic work, I'm an associate clinical professor in pediatrics and family medicine here at the University of Alberta, and I preceptor medical students, residents, and fellows in pediatric sport medicine. I'm also a committee member for our undergraduate MSK block, and I'm the Pediatric Week coordinator for our MSK block for the 6 weeks here at the University of Alberta for our second year medical students. And then my national kind of organization work, I'm the current secretary treasurer for CASM, and I did complete a 2-year term as a board member prior to this. So it's not just patients I see in the clinic, but I do have some academic and some volunteer and national organization work as well. So just some final thoughts, kind of I was trying to putting this together and I'm like, what would be the advice I'd like to give to students kind of thinking is don't be afraid to make your own way, be a trailblazer. And I kind of think of that as myself kind of coming back after my fellowship and having to make my own way. The other thing is create a work environment that brings you joy and fulfillment. I think it's super important for physician well-being and for your own health that you need to be working in a place that brings you happiness and fulfillment. Last, I think it's okay to change your mind. As I told you, I kind of did change my mind multiple different times during residency and medical school, and it's okay to do so. And then finally, don't lose sight of why you wanted to become a physician in the first place, and be true to your own compass, and try not to let outside influences change that mind. So I think we're going to be doing questions at the end, but I'm not sure if I can if there's chances for a few questions now. Dawn, are you able to kind of help us with that?
Yes, so if you have any questions, if you want to pop them in the question and answer section, and Erika, Erika, I'm not sure you can see them. The first question comes, could you share a little bit more about your role with Skate Canada, attending competitions or working with certain athletes, etc.?
Okay, yeah, so my role with Skate Canada is I'm on the roster of team physician. So there's about 12 of us that do travel with the national team skaters for both international competitions primarily. So I started working with the junior team and then moved up to the senior team, and I travel kind of once and twice a year to international Grand Prix events. I did have the honor of being selected to be the team physician for the Pyeongchang Youth Olympics Pyeongchang Olympics for Skate Canada for our figure skaters. So that was a sort of highlight of my sport medicine career, and that was great. But I also do locally. I have connected with some of the local figure skating organizations and chatting with the coaches and stuff like that. If they have skaters that have injuries or questions or issues, we either chat over phone, text. I see the kids in clinic, and then also when local competitions are here, for the last number of years, we've held what's called East-West Challenge or the Skate Canada Challenge, and I've been the organizing physician to organize the medical coverage for that competition that happens at the end of December, or it's the end of November, for about 500 skaters. So kind of organizing in that regard. So that's kind of my role with Skate Canada.
Excellent. Thanks, Erika.
Welcome.
As I said, we can, there's one more. We'll do one more and then we can start doing some questions at the end. As a pediatrician, was there any extra things you needed to do within the college to be licensed to care for adults?
So this is where the difference between what you're going to do. So my consults and patients I see in the clinic are all under the age of 18 to fall within my pediatric license for Alberta. When I travel with teams and see and work with some of the young adults, what we provide is classified as advanced first aid. So your license would cover that, but I don't see them for ongoing care. It's more just if there's an acute issue that's happening, I'm able to do that. So that's where maybe some of the differences lie.
Great. Now, Erika, you can go in the chat. There's a couple of questions in the chat. If you can privately and answer those, and we'll take questions at the end as well.
Okay, perfect.
Let's move on to Dr. Lindsay Bradley. Lindsay Bradley is a fellowship director here in Ottawa. I will let her introduce herself. She's going to talk about her own route through fellowship and her work as a fellowship director and the PGY3 program.
Okay. All right, welcome everybody. I just want to make sure that everybody can see just the regular slides, right, and not the kind of presenter stuff. Yell at me if you're not seeing that properly. So yeah, as Don mentioned, I'm Dr. Bradley and I'm the program director at the University of Ottawa's PGY3 program in sport and exercise medicine. And I'm going to talk about the fellowship route or PGY3 route to sport medicine.
Hi, Lindsay. We actually see the presenter view.
Okay, I will think if I click this, it works. Yeah,
Yes, now I can see it. Yep.
Great,
Thanks.
perfect. So, I mean, all of you are on this talk now because you're interested in sport medicine, but just sort of a brief overview. So, sport medicine physicians are able to diagnose and manage sort of acute and overuse injuries, anything that's really related to muscle, joint, tendon, ligament. We also have a lot of training in prescribing exercise and physical activity to treat sort of chronic conditions. We also look after exercise-related medical issues such as concussion or asthma or different heart conditions that are affected by exercise. And as sort of Erika talked about, we do provide care for people of all ages at all levels, so recreational, elite, professional sports, and all of that entails. Including athletes with disabilities or athletes whenever they have other sort of more family medicine or medical conditions such as sort of mental health issues or things like that. And we also looking at things about preventing injury and illness related to physical activity. In addition to our clinical work, most sport medicine physicians will have some element of sort of teaching and either medical training programs or teaching at various conferences for other specialties. And we work in areas of advocacy to sort of promote sport medicine and healthy active living in various different organizations. So what does a PGY3 mean? So family medicine residency is 2 years after medical school, and there are a number of different what's considered PGY3 or third-year programs after the core family medicine program. And they're in various different areas such as emergency, anesthesia, palliative care, and sport and exercise medicine is one of those PGY3 programs. And so the programs that are available in Canada, there are 12 different programs, I believe, across the country. And so there's 4 in Ontario, 4 programs in Quebec, and a couple of those are new. The University of Manitoba, University of Calgary, and University of Alberta in Edmonton, as well as UBC in British Columbia. And though all of those programs are kind of governed by the same core curriculum, so the Canadian Family Physicians of Canada, the CFPC, has created these priority topics or sort of key features for competence in sport and exercise medicine. And so most of the all of the programs teach to these sort of core features. And at the end of all of these programs, these are all accredited programs, so you receive a certificate of added competence from the CFPC. And so with that, you sort of, you get the certificate of added competence at the end that allows you to practice sport medicine. So just as an example, and all the programs are slightly different, but as an example at our University of Ottawa program, so it's a full year program that consists of 13 blocks. And in Ottawa, we would have 6 blocks of primary care sport medicine at about 4 or 5 different clinics in the city. And so you get different exposure to the ways that different people practice, but in sort of the realm of primary care sport medicine. And again, that sort of has all conditions and all ages. We also do off-service rotations in orthopedics, pediatric orthopedics, plastic surgery and radiology, rheumatology, physiatry, and sort of more exercise medicine. And throughout all of these, because this is considered a fellowship program, you already have your training in family medicine, you could be a family doctor, all of these are tailored to the objectives that you need for sport medicine. So you don't get stuck sort of on the floor managing conditions from a surgical program. You're basically seeing things in clinic or in the operating room that are going to be relevant to your sport medicine objectives. Many of the programs have family medicine half days or a connection back to family medicine, because a lot of residents and students would like to practice sort of a hybrid. And so we keep that connection back to family medicine. And as well, it's really important because a lot of the conditions that we see have some basis in primary care. So continuing to be familiar with up-to-date treatments of things within family medicine is important. Our program has monthly academic days, which includes an MSK ultrasound curriculum, as well as a longitudinal clinic where the residents get to follow their own patients over the course of the year. So they get to know sort of what happens after you order something and what comes back afterwards. We have community rounds and journal club, and the residents have access to our anatomy lab as well, to sort of foster their interest, just like Erika. The programs also prepare you for event coverage. So many of the universities have you doing event coverage for the varsity athletes. In Ottawa, you provide coverage for the University of Ottawa athletes as well as the Carleton University athletes. And to write your CASM exam, so the diploma exam, most residents will write this near the end of their PGY3 year. And in order to write that exam, there is a requirement to have about 50 hours of event coverage, which all the programs in Canada, you get, well more than that throughout your fellowship year of event coverage. So that allows you to prepare for that exam. So just a little bit about my journey, similarly to sort of Erika's discussion about that. And so this slide just shows sort of a number of different projects that I'm involved in. And in no way is it meant to be sort of a look what I can do, but really just to show the broad scope that sport medicine can allow you to do in various different aspects. So I did my undergraduate at McMaster University, and then I went to the University of Ottawa for my medical school. And during that time, I always had an interest in sport medicine or MSK. And so going throughout, I was a varsity athlete in my undergraduate. And so I always kind of had this idea that I wanted to do medical school or physiotherapy. And then when I was in medical school, I sort of knew that I wanted to do something in either orthopedics or sport medicine or physiatry. And I think that that's a common question that students will often ask, like, how do I pick sort of between those? And it really just depends on your interests. And you can sort of change your mind along the way, as Erika mentioned as well. So, I enjoyed all aspects of things like orthopedics or physiatry, physical medicine, and rehab, but I found that the intricate details of surgery, I was wanting to see what happened to the patients afterwards. I wanted to see them in clinic and find out how their surgery went. And same sort of with physiatry, I was drawn to the athletes that had a spinal cord injury or the athletes that had an amputation versus all the other aspects of physiatry. So in speaking with some great mentors that I had, they realized you can combine all of those things that you like through family medicine and through sport medicine. And so that's what I did. So I was lucky enough to do my fellowship at the University of Ottawa. And then when my fellowship was finished, I got a job at Carleton University, which is the other university in town, at the sport medicine clinic there. And there I look after a couple of the varsity teams. So I look after women's basketball and women's rugby mostly, but share the duties of some of the other sports with my colleagues. In addition to that, I like to do teaching. So I do teach in the Department of Family Medicine at the University of Ottawa, and I'm also an adjunct professor at Carleton University in their Health Sciences Department. And so I look at teaching our residents, our PGY3 residents, in my program director role, but also sort of teach the MSK components of the family medicine residency and help teaching sort of MSK skills at the medical student level as well. Throughout sort of my, early years, I was able to volunteer at a lot of local events. And that's one thing in sport medicine. We're all really excited about doing the big events and being a team physician, but there's something to be said for doing a lot of the local events and getting your foot in the door and getting lots of experience at local marathons or sort of smaller leagues or high school tournaments, those types of things. And sort of being in the right place at the right time. One of my mentors and teachers was retiring from being team physician of the national sledge hockey team, now known as para ice hockey. And so I took over that role slightly shortly after my fellowship ended, and was their team physician for within Hockey Canada for about 5 or 6 years. Other sort of roles that I hold, so the Ontario Medical Association has a sport and exercise medicine section, and so I'm on that executive, as well as sort of chairing some committees at CASM. So lots of different opportunities to become involved in sport and exercise medicine related activities that aren't necessarily clinical based or team coverage based. And then there are a number of local teams in Ottawa that I have been fortunate enough to help provide coverage for. So I think the really interesting thing about family medicine in general is you can kind of tailor your practice to your special interests, and sport medicine is no exception to that. Even within sport medicine, there's various different things that you can do. So I have a special interest in para and adaptive sport medicine, as well as mental health in athletes. And I also really enjoy sort of designing conferences or continuing professional development and curriculum design for our residents. So those are kind of the areas that I have tailored my practice to. But early on, I worked as an operating room assistant. I've worked in a hospital setting. I did some family medicine when I first started. So over the years, I have changed my practice depending on sort of what my interests were at the time. So doing a fellowship in primary care sport medicine, so after you finish your family medicine training, your one-year fellowship program, many different sport medicine physicians practice in different ways. So a lot of them will work in primary care sport medicine clinics, or sort of in physiotherapy clinics, as Erika had mentioned. A number will become operating room assistants with their orthopedic surgery colleagues. A significant proportion of our sport medicine physicians will practice a hybrid of family medicine as well. And many will work in the emergency department or walk-in clinics and student health. And many will change that throughout their time. So as I mentioned, I did do operating room assistant when I first started. And then as I took on more academic roles, sort of slowed down on that a little bit. So this is the fun part. This is what everybody wants to go into sport medicine for, to be a team physician. And the really exciting things about being a team physician is, many of us, our sporting careers are slowing down or over, but it allows you to still be part of the team again. And allows you to be part of a really great allied health team. So we work with athletic therapists, physiotherapists, nutritionists, strength and conditioning coaches, all of that. And it's really collegial environment. And the really great thing about being a team physician is you often then get to be their family doctor as well. So when I worked with the sledge hockey team, I was, essentially the family physician for these guys for a number of years. So made sure that they were up to date on all their preventative health care, dealt with them when they had sport injuries, but also when they had coughs and colds and all of that kind of stuff as well. So it's a really neat opportunity to combine your sport medicine skills as well as your family medicine skills. And you do get to be part of the team. And so that means you get to celebrate in their successes and the glory of winning, and you get some cool swag when things go well, and you really get to feel like you're a part of the team, that you were a contributing member to those successes as well. One of the great things about sport medicine is our opportunity to travel. And so this picture on the right is our team in Italy. And so you get to go to some really neat places, and sometimes your family gets to come to some really great places as well. But you also get to navigate the medical system in those countries. So, trying to get, imaging or procedures done when you're in another country, or deal with issues when there's language barriers and such. So it can be a really exciting field in that sense, as well as being part of the team that manages the day-to-day things of travel. So managing, jet lag and making sure that everything is set up for the health and safety of the athletes when you're traveling long distances. In addition to being a team physician, there are opportunities to be sort of part of the core medical staff at MultiSport games. So MultiSport games is when everybody sort of comes together, and there's various different sports being played at the same time. So here are just some pictures of the Invictus games and the Canada games. And the Canada games are a really unique opportunity for physicians when they're first starting out, because they usually need a large number of physicians to help cover those games. So it's a really great great games to develop relationships with allied health professionals and other sport medicine physicians, sort of oftentimes earlier on in their careers. And you get to meet a lot of people and forge those relationships, and those relationships sort of last, you know, a long time. So those are some really neat opportunities. And sort of, as I mentioned, you know, many of us, our sporting careers are slowing down or over, and being part of games allows you to do those things that you might not have otherwise. So, you know, walking in an opening ceremonies or those types of things can be quite powerful, and great to be part of those teams. The other thing in sport medicine is we have a number of really, really great mentors, and middle picture there is myself and Dr. Andy Marshall. And I've been lucky over years to have some really, really great mentors in various different aspects of my career, to show me, you know, the ropes and show me what I can do and guide me along the way. And we're really lucky in sport medicine to have a great community of mentors and preceptors that allow us to kind of get our foot in the door and have some really, really great experiences. And we're really lucky in sport medicine to have a pretty small and tight-knit community. And one of the other things at games that's really great is that collegial environment with the sport medicine team. So this is the Parapan Am Games that just passed in Lima last summer, and this was probably one of my favorite sport medicine teams to work with. It was a really, really great group of people, and everybody worked really well together, and we had a lot of great times. And I think that that's one of the things that sport medicine physicians love about sport medicine, is that team aspect and environment that we get to participate in. So, I mean, those are the fun things. Those are what everybody likes to do, likes to talk about. We love to show all these wonderful photos of the things that we do. But really, from a day-to-day perspective, there's lots more to sport medicine. And like I mentioned, education and curriculum sort of at the medical school level, at the family medicine residency or specialty residency level, and as well sort of at the PGY3 level. Conference planning, presentations, continuing professional development. So many of the provincial sport bodies have a sport medicine section and then provide some CME. And then as well as CASM always has our annual conference, as well as a number of different professional development courses, team physician courses, advanced team physician courses. So one, participating in those as residents and students, and then as you get out, sort of being part of the committees that plan those. Many of our sport medicine physicians participate in research, and it's not a requirement, but it is a great way to sort of advance the field of sport medicine, which is fastly growing. And lots of opportunities to be part of committees and to get sport medicine sort of out there and known. So as I mentioned, our provincial medical associations, OMA and the Alberta Association, they have sport medicine sections, and you can be part of that group. The Canadian College of Family Physicians, they have sort of a sport medicine group. At CASM, there's a number of different committees. So I'm part of our para and adaptive sport medicine committee, and we look at providing care to para athletes and sort of advancing the teachings and learnings in that area. So we plan conferences, but there's a pediatric sport medicine group. There's interest groups in a number of different avenues at CASM. So a really great way for students and residents to get involved. They're always looking for people. And then often, you know, we're asked to be medical consultants in a number of different groups. So I'm the Ontario representative on the U Sports, which is the governing body for the varsity sports across Canada. But many people will sit on the boards of their local organizations, or local hockey or ringette organizations, or soccer, or those types of things, sort of, you know, designing medical policies and procedures and those types of things, as well as the Canadian Paralympic Committee or the Canadian Olympic Committee. They'll have boards and committees as well where you can get involved in. And as I alluded to before, and I'll sort of end on this note, is our community. So our sport medicine community is so wonderful. Everybody is very welcoming. CASM is a large organization, but a small organization at the same time. It seems that everybody knows everybody's name, and we see each other at conferences and events and have a really, really great time. And as I mentioned, that mentorship aspect of things as well. So I think that being part of sport medicine allows you to sort of join that community. That's really, really welcoming, and that I've had a really, really great time being part of. I think you're on mute there, Dawn, sorry.
Okay, so we do have a couple of questions. Is it possible for Canadians who are doing a 3-year family medicine residency in the States to apply for a Canadian sport medicine fellowship?
Yeah, so there's definitely different rules on that. So currently our PGY3 programs in family medicine are run through CARM. So the Canadian, I don't remember what it stands for, residency match. And so I believe that as long as you're eligible for the match, you can apply, but I would maybe defer to that CARM's website to be sure. I believe you have to be a permanent resident in Canada or have your residency status. So it doesn't matter where you completed your residency. You have to, if you completed your residency in the States, that's fine as long as you are a Canadian citizen or a Canadian resident, and you would just have to write the Canadian family medicine exam.
Thank you. There's a few questions in here that will be actually answered by Dr. Menard, so I'm going to go for the ones that you can answer directly, Lindsay.
Yeah.
How realistic is it to become a team physician? Could you also speak to the lack of female physicians in high-level sports teams? This is changing.
Yeah, so I mean, to become a team physician, like I mentioned, there is going to be a lot of work sort of at the local level and getting some experience and volunteering your time at various different levels. And I think sometimes there is some luck involved in a way, right? Depending on the city that you live in, what sports are available in that city. I'm in Ottawa, so I'm very lucky. We have a number of different teams here. And I've been lucky to step into some roles, you know, when my colleagues were, you know, stepping down from them after they'd done them for a number of years. So there is some element of right place, right time, but also doing your work and biding your time. And you may not get it, you know, first few years out. And there are, you know, many physicians who will start going to Olympics and Paralympics, you know, in their 40s and 50s or even later. So I think that it's definitely possible, and you just have to sort of, you know, work at it and depending on where you are and that sort of thing. Your question about sort of female physicians, I think the trend is changing. I mean, Dawn might have the answer to how many female CASM members we are, but I think we're equal, if not taking over at this point from and that's one thing that CASM is really great at from a diversity point of view within our organization. Our board is always very highly supportive of female physicians and leaders in that area. I think with certain sports, I won't lie, I mean, it is sort of challenging sometimes for female physicians to get into certain organizations. I was the only female staff on a male team in Hockey Canada for quite some time, and but those things are changing. Professional sport, you know, in general is changing. We're seeing female coaches coming out as well. Professional sport in general is tougher to get into. There's lots of sort of legal aspects and liability things as well. So not everybody wants to be, you know, a team physician of professional sport because of those things. But I definitely think that the trend is changing. And if it's something that you are passionate about doing at that professional level, there's definitely those of us who are plowing ahead of you to pave that way. And as well, there's some really great women's sports too, you know, so we want to make sure that we're holding down those jobs as well, sort of women leaders in women's sports.
Excellent. Thanks, Lindsay. We do have a lot of questions. We're going to wait until the end to answer the rest of them. Darrell, the next presenter is Dr. Darrell Menard. Darrell has a great story in terms of his route through sport and exercise medicine. So I will let him tell it. And then, as I say, he will answer some of the questions you've already asked. And then we'll do a little short question and answer at the end. Thanks again. So over to you, Darrell.
Okay, thanks, Dawn. Well, welcome everybody. You've just heard from two of the current leaders and the future leaders in our sports medicine organization and sports medicine in Canada. And I'm more of a dinosaur that is coming along. I've been here for a while, but I think I have a few things that I can share with you. My sort of road to sports medicine started out when I was 15. I became a distance runner and competed eventually nationally and then internationally for quite a long time. And I decided to go into physical education for my university degree, which was a passion that I had. It wasn't called human kinetics then. And when I was in that program, just the same as Erika, I found that I actually had a love for anatomy, and I really liked our sports injury course. But the problem was I was very interested in how to treat the problems, and I knew, or I realized then, that as a physical educator, I wasn't going to be able to do that. So when I was 29, I went back and did a master's degree on leave without pay from my job. So I had 2 children then and a wife. So we lived in poverty for a year while I did this academic master's and did a bunch of medical prerequisites. And then that still wasn't enough to go back to medical school. So I guess I went back when I was 26, sorry. And then I had to do 4 years of doing night school or correspondence courses, and then finally was accepted into medical school at Queen's. I knew the reason I went back to medical school was I knew I wanted to be a sports medicine physician. That was a little different than Erika. She evolved into that, but that's why I went back. And I had 3 kids and a wife, and I had to still go through medical school and all the other training to be a sports doc. So, you had to have a strong commitment to do that if you were going to go through all of that, because depending on me if I failed in this regard. So I was very lucky. I was very persistent. I knew, as Erika and Lindsay had said, I pushed. When I was in medical school, I did, my electives were in sports medicine. I did my internal medicine, presentations were on sports medicine topics, et cetera, et cetera, et cetera. So everything that I could was oriented towards sports medicine. And then I was in the military. I did 40 years in the military, and they had no sports medicine program. So I had to do my training for my diploma examination on my own. They gave me some time to allow me to do that. I'm very grateful for that. And I was able to actually challenge the exam and pass. And since then, I've been a sports medicine physician for the last 26 years. The really cool part about it is the military did not value sports medicine at all when I first started proposing this. And now they have come to realize how important it is to the actual manpower, to preserving the manpower in the military. And so I now sit as the sports medicine advisor to the Surgeon General, and I'm working closely with the Army to try and get them to stop destroying their soldiers by doing stupid training. You heard the ladies say, they had different interests and different skills, and you can all contribute to sports medicine in different ways. I like to write. I have always liked to write. So I contribute to, one of my contributions to the program is I write the series called Ask the Expert, which are published in military media outlets and through CASM, and they're available to you on the website. So again, translating complicated topics into topics that are aimed for the average person to understand. I enjoy doing that. So I get a chance to I'm very grateful I get a chance to make that contribution. So from here on, I'm going to show you just a little journey about the things that I enjoyed. So this picture that you see on the screen is me in New Mexico in 2005 with the national military running team. The little tiny little guy there was somebody else's son, not me, not one of our athletes. But I got to train with them. I lived with them. I traveled with the military national running program all over the world for 25 years. And some of these guys are basically my children. One of them two of them in this picture have gone on to become physicians. One of them was a nurse and said, I want to take your job in the future. And he is now a sports medicine physician in the military as well. So very happy about that. Oops. Oh, so these are the kind of things that I see in my practice regularly. So this is an example of bone-on-bone osteoarthritis of the knee, and I often see patients who come in, and because they've had the wrong x-rays done, so the x-ray on the right-hand side is what the wrong x-rays show of their knee. When you put them into a weighted view, you are able to help that person when the diagnosis was eluding other people. I've lived in the same community now this is my 29th year of practicing in a small community outside of Ottawa. This little boy is now in his 30s, and I had a family practice, sports medicine practice until about 2 years ago, and now I just do sports medicine. But this is one of the people that I would see. And as I said, this guy is 30-something years old now, and he and a little girl spent the afternoon picking the beautiful wild parsnip flowers and came in with this photosensitized reaction. Barfly elbow, another thing that you will see commonly in your family practice and your sports medicine practice. This is a little bit of an unusual presentation because I don't see that many distal biceps tears, but this is this reverse Popeye where the bicipital tendon gives way in the elbow region as opposed to up in the shoulder. And this person actually ended up having surgery for that. This is a young man that I have known since he was a child. And he comes in and he says, I have some terrible acne. And you're looking at him and you're going, well, that really is terrible. Like, he didn't have this before. I said, what have you been doing? So he was taking anabolic steroids to actually build himself up, not to be competitive, just to look buff. And he was doing okay, but he said, well, maybe I'll do even better if I add a second anabolic steroid. And this happened. And this is him 6 months after coming off the anabolic steroids. So this keloid-like scarring that you see on him is permanent as a consequence of steroid use. I saw a gentleman that came into my practice with a knee that was about to explode. And I'm sure most of you have seen this, where you're wondering how it doesn't. It was so full of fluid, at least I thought it was. And he was in agony. I said, listen, I'll pull that to be more comfortable. And I'm trying not to be immodest, but I do a lot of needle work and I'm pretty good at this. And I put the needle into this, it's almost like throwing poop at a barn from about 2 feet away. I mean, how can you miss? So I put the needle in and I got nothing. And I actually ended up moving the needle around and putting it back in 7 times and I still got nothing. So I said, there's something very, very wrong here. So we did the MRI, which you see up in the top left-hand corner. And this guy had this lipoma aberrans, which at the time, I think there were about 19 cases described in the world. And his knee was about to explode, but it was full of hypertrophic synovial tissue. And the reason I couldn't pull any fluid out was there was no fluid and it was just the synovial tissue. So people with this disease don't tend to do very well with that joint. I also have covered, I don't know, I couldn't even tell you how many events. I enjoy doing that, as you can see, both Lindsay and Erika do. It is usually a lot of fun. This is the Ottawa, or this is the Army Run, but the Ottawa Race Weekend and the Army Run. One of the things is to be a finish line catcher. This woman has the classic look of deer in the headlights. And if you don't get to these people or something because they are completely gone, this woman has no idea where she is. And we were trying to just get her across the finish line and then get her in for to be resuscitated. This, unfortunately, is the same race scenario in Ottawa. That mat that you see underneath my feet, I'm the guy with the Canada hat on, is the finish line. This guy literally hit the finish line and was in VFib. We had a machine at the line, and we were able to actually put the paddles on him, and we hit him, and you know, God bless him, he came back with one shot and went into normal sinus rhythm, but he was literally dead on the finish line. And so that can get your heart rate up when you're looking at that at the finish line. So covering these events can be fun, but it can also be quite scary sometimes when you see these kind of consequences. This guy did just fine. One of our physicians who was covering this national team could not go away to CONCACAF, which is the qualifying round for the World Cup for this U17 women's team. So I had the chance to do that, and lo and behold, in the after double overtime, we won the championships against the Americans in a shootout, which meant we're going to the World Cup. And so we did go to the World Cup, but it wasn't quite as happy at the World Cup as it was at CONCACAF. And I tried to talk to the coach about how much overtraining we were doing for these girls, but you can only push so hard as the team doctor. And these girls were just not quite sharp enough. And it's frustrating when you're the team physician and you're saying this to the coach, you're pushing these women too hard, they look like they're tired, and the coach isn't listening, and then you see this kind of result. These girls all had academic scholarships and everything else, but I think we could have done better if we hadn't pushed so hard. I've covered the Youth Commonwealth Games in the Isle of Man, and the reason I show you this is the windiest place I have ever been in the world. Like, I actually was running and got thrown off the sidewalk 3 times into traffic. It just unbelievable. And it was difficult to conduct the games there because of those wind factors. So this is our national youth rugby team playing there. But if you ever want to look for sea glass, the Isle of Man is a great place to do it. With the military, I covered the military's World Cup of Soccer, and it was in Azerbaijan, which is, as you now know, having at war with Armenia, I believe it is. And so when you see this country, downtown is a very modern looking place, but where the area where I was living at, if you walked in the back streets, this is actually on the road where they're butchering cattle right on the road that you're driving on. And this is a very common thing to see. Both ladies talked about the beauty of travel, and I love traveling around the world. And I love traveling because you can see the beauty, and then you can see some of the dirty parts of cultures too. You have to sort of try to get in the back streets and look around, and I like that. I like seeing, you know, how different countries work and their different sort of ways of looking at things. So can you imagine doing this in Canada? That would be impossible, but here it's routine. This is actually a picture of their most popular national beach, where everybody goes to lay down and enjoy themselves. And these little teepees that you see, people lay there to get out of the sun, but they're sitting beside the city dump. That's not the dump. That's just what people do with their garbage, and they don't pick it up. So again, culturally, I don't really understand how you can not take care of this, but that's the way things are there. I am an Indigenous person, covering the North American Indigenous Games when they are being held. So I have worked at the 2014 Games and the 2017 Games. And I love this picture because this shows 2 beautiful young women in their traditional clothing. And then you see them in their athletic clothing, and they're displaying to you that, you know, I am both an Indigenous person and an athlete. And so I really, really enjoyed this cultural experience. This is Regina, and we had in our medical center, we had traditional medicine, so from the various tribes that were there, and we had North American medicine, medical clinic. And this was the smudge tent behind the medical clinic where athletes could go and do smudging, where they use grasses and they move smoke across themselves and purify themselves. So they offered medicine at 2 different levels, which I thought was very impressive. This was the first patient I saw at the Indigenous Games, and she presented telling me that every time I kick the soccer ball, my games are designed to get kids interested in things. So this young lady probably only played soccer for a couple of weeks before she made it to these games. But I had her take her shoes off, and you can see those toenails. They're actually indenting her skin. This is a 16-year-old girl. This is cultural again. And so we actually couldn't trim those nails using a traditional nail clipper. We had to use a ring cutter, and it worked really well. And then she was able to kick the soccer ball without pain. But again, I would never have expected to see this, and you certainly would never see this working with the national women's soccer team at the Olympics. This is badges of honor. This is a young lady who plays lacrosse, and these we call them ball hickeys. If you've ever had a lacrosse ball in your hand, it's really hard. And when these young athletes shoot this ball, it's a rocket. So this lady is basically tattooed all over the place, and obviously looks very depressed that she's been hit so many times. Just a wonderful young lady. So the Olympic Games was something that I had always wanted to do. And when Lindsay was talking about this, she was saying sometimes there's a little bit of luck, and sometimes you're in the right place at the right time. I had applied for the 2004-2008 games, not been accepted. Was told I had a very good resume, but so I said to them, well, why wasn't I accepted? They said, there are no strangers on the Olympic team, and we've never worked with you in these kinds of settings, and if you don't do something different, you're not going to make the team. So then I did Canada Games and all sorts of other things, etc. And I was finally picked at the age of 57. So I made the Olympic team at the age of 57. So I'm very grateful. And I was an alternate. So I had to shoot somebody. No, I didn't say that out loud. Somebody actually was unable to go. And so that was the luck part that Lindsay was talking about to make that team. And this is the basketball team. And but that's pretty much my reaction when I got accepted after all those years of trying. So I was very, very happy. I worked with about 6 teams when I was there. This was the judo team. This is a young man who won the bronze medal in judo. And when I came in the day of his event, they fight all day long. It's a 1-day event for each athlete. His first fight was against he was 27th in the world. His first fight was against the reigning Olympic champion. His next fight was against the reigning world champion. His next fight was against a former world champion. His next fight was against the guy who eventually won the World Olympics, and then a guy with a medalist at the World Championships. And he fought on and on and on, and eventually won the bronze medal. And it was extremely gratifying to actually be there working with him to see him win that. The night before the weightlifting finals, I met these 2 young ladies. Christine Gerard is in the middle. And I said, well, what do you do? And she said, well, I'm a weightlifter. And I said, well, you're not very big. I don't believe you. And so I was teasing her, and she said, well, I've got 60-centimeter thighs. And I said, I bet you my thighs are bigger than your thighs. So we had the great quintessential quad showdown. So the lady on the left measured 54 centimeters. Christine was true to form. She was 60 centimeters. And the old guy there was only 48 centimeters long. So I really got whacked good. And yeah, her biceps probably were bigger than my thighs. So then she went on. She was there. She had come 4th, painfully 4th in the 2008 games, and she wanted to actually vindicate that. So she lifted and won the bronze medal and was very, very excited about that. But even more important, 6 years later, WADA disqualified the two people that were ahead of her in London, so she got her gold medal. I was lucky enough to be there when she was presented that after the fact, and her fourth place in the 2008 game was upgraded to a bronze. So that was a very special moment to be able to share that with her. So here's the kind of things that you can see. I covered the Pan American weightlifting championships in Oshawa, and this is the Olympics, but this is 432 pounds landing on this guy's neck. So if that was me, I wouldn't be talking to you right now. I would be looking at the grass growing above me. But this guy is so big and strong that he really wasn't badly damaged by this. This is at the Pan Am Games, and you can imagine this lady was doing a snatch, and she just lost it. She pulled it a little bit too far back, and you can imagine what that does to your shoulders when you're there. And you're sitting just off the side covering this event, and you have only a short period of time to take care of these people when they're injured to keep things going. The Parapan Am Games, you saw Lindsay show a fair bit of her involvement in the Paralympic movement, and I've been very fortunate to be involved as she was. This is our team. Dawn, you can see sitting, our moderator is sitting in the middle of that pink chair, and there's a whole bunch of leaders in the world of sports medicine that are there for those games that were held in Toronto. This young lady was our assistant chef de mission, one of the most decorated swimmers in Canadian history. She was born this way, and you know, one of the things that she loves to do is dance, and she's a little hyper, and so you'd be around her, and you just, as I said, it's amazing to me to see somebody who, with that level of disability, well, she wouldn't call it disability, but that level of physical change, who was able to do so many different things. It's amazing. It's very inspirational. This is Rio, and I came by this guy. This guy's a Canadian, and he's sitting on that chair. He has no legs, he has no arms, and I go by and I said to him, what are you doing here? And he said, well, I'm working. And I'm going, in my own brain, I'm going, yikes, like, how can you work? You don't have arms, you don't have legs. And he's working with the athlete representative program. And God, when you actually watch this guy, he does more than I can do in any given day. With, you know, he's got all these things that he's adapted, and it's unbelievable. He competed in the games in the Paralympic Games in London, in Bache, and the guy beside him, you see in the background, is gradually gone from being on the rugby team to this, and they ended up winning the bronze medal at those games. So you do see these amazing stories of people who are, I mean, I stop complaining about things when I see these folks. I go, listen, you don't have much to complain about when you see what these folks are able to do with their lives. I worked with the soccer team. I spent a lot of time with soccer, and I used to play keeper. This guy was a keeper. He has cerebral palsy. You can imagine, if you've ever played soccer, how hard it is to stop a soccer ball as a goaltender to begin with. But with cerebral palsy, it's really difficult. So my home dog, Corey, and I got along really well, and I really enjoyed bonding with those guys. They took me in under their wing, and they actually said, maybe, Doc, we can arrange to have something hit you, and then you can become part of our team. And I thought, well, no, guys, I love you guys, but I don't need that to be part of the team. I was fortunate enough to coach and compete at the 1980 Paralympic Games, and there I met a very young Rick Hansen, who was not the Rick Hansen that you guys know. Then he was really, I don't like to use the word nobody, but he was not known by anyone at that point in time. And here we are at the at the Parapan Am Games in Toronto, and I get to meet him again. So that was really quite cool. And you all know the amazing things that he has gone on to do in terms of opening doors for people who have supposed disabilities. In Rio, I was part of the Paralympic team. I was very lucky to be there. Once again, I believe I was an alternate and I made the team. There's 2 dead sports medicine physicians now because I had to have them taken out. And this is Copacabana Beach, which is a really hard place to work. Just, it's so awful and a terrible, terrible place to work. These are athletes that we got to work with. And what I love about this picture is you can see all 3 of these women are extremely excited about their victories, and they are not at all embarrassed about their limb deformity at all. They're quite prepared to show it to you, and they're going, this is who I am. And if you don't like me, you know, that's your problem, but this is what I am. I love that. Getting ready to go to Rio was different. This was a sign that they had prepared at the airport. Welcome to hell. The police and firefighters don't get paid and you're not going to be safe here. So as we prepared to take the team there, we had to be very conscious of these kinds of security issues. I was covering sailing and triathlon where they were going to be in the water. And this is what the water looked like in some of the areas. They had to clean this up. They were training before the events, and we had sailboats capsize because they hit couches that were just below the surface of the water, floating there. So this was a monumental cleanup job. And again, we had to be very cautious. We had an athlete get a scrape and they got infected very, very quickly. And there are things in this water that apparently no antibiotic in the world can cure. So we were really a bit worried. I was fixing a door one day because it was squeaking and really very annoying. And this athlete comes in and she had a little problem. So I'm giving her the magic WD-40. And this is just an example. This woman was so playful with this, her prosthesis, and was quite willing to do all these fun things with this, and not at all, again, self-conscious about having this prosthesis. This athlete, very, very, very high amputations on both legs, comes out of he runs 200 meters, comes out, the first 100 meters is unbelievably slow, and the last 100 meters, he's got to run it in 5 seconds. It's just crazy once he gets going, so it's quite impressive to see. This athlete, I know I can't communicate with you directly, but this athlete, you probably wouldn't think of as a tennis star, but he is. So again, you know, you're thinking, no arms, why would you want to be a table tennis player? But that's what he wants to be. I don't need to say anything about this picture. I love this. I have one leg, but I'm a high jumper. And now I'm letting go of these things and I'm going to do what I do. This young man Eric has muscular dystrophy, and that little cart, Eric can move his index finger, he can move his lips, and he can move his head a tiny little bit, and he can move his eyes. That's it, nothing else. And this woman that you see on the other side, helping him with his getting set up for bocce, I was at the games watching her, and she was chasing him all over the Olympic Village because he was just so excited to be there carrying on. And you know, he was so surprising. I mean, I was talking to someone and I was sort of thought, well, with this much disability, maybe he can't actually and this mentally, and meningitis, lost both of her hands, both of her feet, and ends up the Paralympic gold medalist in fencing. The last event that I was at was the games in Naples, the summer universiade. this is what we work out of. When we came in, it was an empty little segment that big. We had that little steel thing, and we had these two little tables. Nowhere in Naples could you buy anything more, so I had to go into the garbage and steal boxes and make the rest of these things for our containers, etc. But that's the kind of thing you have to do. And in the military, sometimes when you're in different settings, you have to improvise that way too. And I like that. It doesn't have any impact on the quality of medicine that you provide. You just have to be inventive. And I really do enjoy practicing that way. This young lady was about to go to first year medical school. She was on the rugby team, and I think this was her first game, and unfortunately had that fracture. And so she really had her time there upset, but you could see from the look on her face that she's a champion, and I'm sure she one day maybe will be one of our sports medicine leaders in the future. This is a guy who was experiencing hypoglycemia. He was almost at the finish line. You can see him. He's looking at the finish line. He's trying to dig his heels into the ground to crawl to the finish line, and they won't let him. So they pick him up, and what do? They bring him into the back, and they throw him into a freezer, like a big freezer, and they don't bother looking at hydration, and they don't bother to try to give him something to get his sugars up. And once we finally got them convinced that maybe if you gave him a little sugar, he started to settle down. But you can see that look in his eye. That look says absolutely everything that anyone would want to know about that condition. This was track, which I covered there, and there is one of our hurdlers. If that was me, I would probably be a quadriplegic right now, but with this guy's musculature, he was able to actually do that lawn dart motion and simply sustain a concussion. He has recovered from. A little important thing for you is, and I think this is exactly what Lindsay and Erika were saying, if you're really interested in this, get involved. I've had more fun working with Atom hockey teams. I worked 17 years with little hockey teams before anything happened. I mean, one of the guys, when I got selected to the Olympics, he said, this is a long way from being the trainer for our Atom hockey team. And I said to him, you know, it's actually not that different. It's just that the stakes are a little higher. But from my perspective, it wasn't all that different. So if this is something that you're interested in, you just might find your calling here in Chasm. There's room for all kinds of people with different interests. And that's it for me.
Thank you very much, Darrell. I think you covered, between the three of you, the whole depth and breadth of the different paths to become sport and exercise medicine physicians in Canada. I want to thank each and every one of you. The questions have all been answered. Thank you for going and doing that. Again, if you have any questions on this presentation, you can always contact me. I'm at Chasm head office, and the website has my details on there. So once again, thank you for your time. I hope you enjoyed the webinar. This will be recorded, and we'll send a copy to each and every one of you. Thanks again.
Good luck in your careers, everybody.
Thanks for coming.
Bye-bye.